Today I'm going to tell you about a blood pressure medication that's transforming how we treat hypertension in people over 65. And if you're not on it yet, you need to ask your doctor why. I'm talking about Losartan potassium, which belongs to a class of medications called ARBs, or Angiotensin Receptor Blockers. Now, I know what you're thinking. You've probably seen videos warning about dangerous blood pressure medications, and you might be wondering if this is another one to avoid. But here's the truth that every cardiologist and geriatric specialist knows, but patients often don't hear. Losartan is actually one of the safest and most brain-protective blood pressure medications available for older adults. In fact, major research studies have shown that people over 65 taking Losartan have lower rates of dementia, better cognitive function, and fewer dangerous side effects compared to people taking older blood pressure drugs like beta blockers and diuretics. If you or someone you love is over 65 and taking blood pressure medication, this video could change your treatment plan and literally protect your brain while controlling your blood pressure. Here's what most people don't understand about blood pressure treatment in older adults. For decades, doctors prescribed the same medications to everyone regardless of age. Beta blockers like atenolol and metoprolol, diuretics like hydrochlorothiazide, calcium channel blockers like amlodipine. These medications work to lower blood pressure. That's not the issue. The problem is that when you're over 65, your brain, your kidneys, and your cardiovascular system have different vulnerabilities than they did when you were younger. Your blood-brain barrier becomes more permeable, meaning medications that never affected your cognition at age 50 can suddenly start interfering with memory and mental clarity at age 70. Your kidneys process medications less efficiently, leading to accumulation and side effects. Your heart's electrical system becomes more sensitive to disruption. What we've discovered through large-scale research involving hundreds of thousands of elderly patients is that certain blood pressure medications not only avoid these problems but actually provide protective benefits for the aging brain. Losartan is at the top of that list. Let me establish my credentials so you know this isn't just opinion or marketing. I'm a board-certified physician specializing in cardiovascular medicine and geriatric care with over 25 years of clinical experience. I've treated thousands of patients over 65 with hypertension, and I've watched the evolution of our understanding about which medications are truly safe and effective for aging populations. I've published research on medication management in elderly patients. I've worked in academic medical centers where we analyze data from massive clinical trials, and I've served on committees that develop treatment guidelines for hypertension in older adults. What I'm about to share with you is based on solid, peer-reviewed science from some of the most respected medical journals in the world. This isn't theoretical. I prescribe Losartan to my own elderly patients every single day, and I've seen firsthand the difference it makes compared to older medications. Before I explain why Losartan is special, you need to understand how blood pressure medications work and why the class of drug matters so much. Your blood pressure is regulated by a complex system involving your kidneys, your blood vessels, and hormones that control fluid balance and vessel constriction. One of the most important systems is called the renin-angiotensin-aldosterone system, or RAS. This system produces a hormone called angiotensin II, which is one of the most powerful blood vessel constrictors in your body. When angiotensin II binds to receptors on your blood vessel walls, it causes those vessels to tighten, which raises your blood pressure. It also causes your kidneys to retain sodium and water, further increasing blood pressure. Now, there are two ways to block this system. You can use ACE inhibitors, which prevent the formation of angiotensin II, or you can use ARBs like Losartan, which block the receptors where angiotensin II tries to attach. Both approaches lower blood pressure effectively, but ARBs have some advantages, particularly for older adults, that I'll explain in detail. Let's talk about the brain protective effects of Losartan, because this is where the medication really shines for people over 65. Multiple large-scale studies have demonstrated that ARBs like Losartan are associated with significantly reduced dementia risk compared to other blood pressure medications. One of the most impressive studies was published in the British Medical Journal and analyzed data from over 800,000 patients with an average age of 71. The researchers followed these patients for an average of 5 years and tracked who developed dementia. What they found was striking. Patients taking ARBs had a 24% lower risk of developing Alzheimer's disease and a 20% lower risk of developing vascular dementia compared to patients taking other classes of blood pressure medications. 24%. That's a massive protective effect. The mechanism behind this protection is actually quite fascinating. Angiotensin II, the hormone that Losartan blocks, doesn't just affect blood vessels in your body. It also affects blood vessels in your brain, and at high levels, it promotes inflammation and oxidative stress in brain tissue. By blocking angiotensin II receptors, Losartan reduces inflammation in the brain, improves cerebral blood flow, and may even reduce the formation of beta-amyloid plaques, which are the hallmark of Alzheimer's disease. Some researchers believe that ARBs like Losartan are doing double duty, controlling blood pressure while simultaneously protecting brain cells from the inflammatory processes that lead to dementia. Another major advantage of Losartan for older adults is that it doesn't cause the cognitive side effects associated with medications like beta blockers. If you watched my video about blood pressure medications that cause memory loss, you know that beta blockers like atenolol and metoprolol can cross the blood-brain barrier and interfere with neurotransmitter function, leading to mental fog, memory problems, and difficulty concentrating. Losartan doesn't do this. It works primarily on blood vessel receptors and doesn't significantly penetrate brain tissue in ways that interfere with cognitive function. In fact, clinical studies specifically testing cognitive performance in elderly patients have shown that people on ARBs perform better on memory tests, attention tasks, and executive function assessments compared to people on beta blockers or even some calcium channel blockers. I've had patients who came to me complaining of memory problems while on atenolol or metoprolol, and when we switched them to losartan, their mental clarity improved within weeks. They describe feeling like a fog has lifted, like they're thinking more clearly and remembering things better. This isn't placebo effect. It's the result of removing a medication that was interfering with brain function and replacing it with one that supports brain health. Losartan also has cardiovascular benefits beyond just lowering blood pressure. Research has shown that ARBs can reduce the risk of stroke, which is critically important for people over 65. A landmark study called the LIFE trial, published in the prestigious medical journal Lancet, compared losartan to atenolol in over 9,000 patients with hypertension and signs of heart enlargement. The patients were followed for an average of 5 years. Even though both medications lowered blood pressure to similar levels, the group taking losartan had a 25% lower rate of stroke compared to the group taking atenolol, 25% fewer strokes, even with the same blood pressure control. The researchers concluded that losartan provides protective effects beyond blood pressure reduction, likely through its effects on blood vessel health, inflammation reduction, and improved arterial elasticity. For someone over 65, where stroke risk is already elevated, this additional protection is incredibly valuable. Let me talk about the kidney protective effects of losartan, because this is another area where the medication excels for older adults. As you age, your kidney function naturally declines. By age 70, most people have lost 30 to 40% of their kidney filtering capacity compared to when they were 30. This makes you more vulnerable to medications that can damage kidneys or that accumulate to toxic levels when kidneys aren't working optimally. Losartan has been extensively studied in patients with chronic kidney disease, and the data consistently shows that it slows the progression of kidney damage. There's a specific study called the RENAL trial that followed over 1,500 patients with type 2 diabetes and kidney disease. The patients taking losartan had a 16% reduction in the risk of their kidney disease progressing to the point where they needed dialysis, and they had a 28% reduction in the risk of being hospitalized for heart failure. For elderly patients who are at high risk for both kidney disease and heart failure, losartan provides a level of organ protection that older medications simply don't offer. Now, I want to address the potassium issue because this is something that comes up frequently with losartan and other ARBs. Losartan can cause your potassium levels to rise, which is called hyperkalemia. This happens because the medication affects how your kidneys handle potassium. In most people, this isn't a problem. In fact, for people who've been on diuretics like hydrochlorothiazide, which can cause dangerously low potassium, the mild potassium-raising effect of losartan can actually be beneficial. However, if you have significantly impaired kidney function, if you're taking potassium supplements, or if you're on certain other medications like spironolactone or ACE inhibitors, the combination can push your potassium too high. High potassium can cause dangerous heart rhythm disturbances. This is why when you start losartan, your doctor should check your potassium and kidney function with blood tests before you start the medication, and again a few weeks after you begin taking it. As long as your potassium stays in the normal range and your kidney function is monitored, this is a manageable issue, not a reason to avoid the medication. Let me give you some practical guidance on what to expect when taking losartan. The most common side effect, which affects about 5 to 10% of people, is dizziness, especially when you first start the medication or when the dose is increased. This happens because your blood pressure is dropping, which is the intended effect, but sometimes it drops a bit too much or too quickly. The dizziness usually improves as your body adjusts over a few days to a week. To minimize this, take losartan at bedtime rather than in the morning, so if you do experience dizziness, you're lying down rather than standing and moving around. Make sure you're staying well hydrated, especially if you live in a hot climate or if you're also taking a diuretic. Stand up slowly from sitting or lying positions to give your blood vessels time to adjust. Another side effect that some people experience is a dry cough, though this is much less common with ARBs like losartan than with ACE inhibitors like lisinopril. If you've tried an ACE inhibitor in the past and developed a persistent dry cough that made you stop the medication, losartan is an excellent alternative because it provides similar benefits without triggering the cough in most people. The typical dose of losartan for treating high blood pressure is 50 to 100 milligrams once daily. Some people start at 25 milligrams if they're particularly sensitive to blood pressure changes or if they have kidney issues. The medication reaches its full effect about 3 to 6 weeks after you start taking it, so don't expect your blood pressure to be perfect after just a few days. It takes time for the medication to fully block the angiotensin II receptors and for your cardiovascular system to adapt. This is why it's important to monitor your blood pressure at home with a reliable blood pressure cuff, checking it at the same time each day, and keeping a log that you can share with your doctor. If your blood pressure isn't adequately controlled on Losartan alone, your doctor might increase the dose or add a second medication. It's very common for people over 65 to need 2 or even 3 blood pressure medications to reach their target blood pressure, and that's perfectly fine. The goal is to control your blood pressure using the safest combination of medications with the fewest side effects. I want to talk about a specific patient case that illustrates why Losartan can be transformative. I had a 72-year-old patient, I'll call her Margaret, who came to see me because she was concerned about her memory. She'd been on atenolol 50 milligrams daily for about 8 years for high blood pressure and had also been taking hydrochlorothiazide. Over the previous 2 years, she'd noticed progressive difficulty with word finding, trouble remembering appointments, and general mental fog that was affecting her quality of life. Her family was worried she was developing dementia. I did a comprehensive evaluation, including cognitive testing, and her scores were lower than expected for her education level and baseline intelligence. Her blood pressure was well controlled on her current medications, but I knew from the research that beta blockers like atenolol can cause cognitive impairment in elderly patients, and HCTZ can cause electrolyte imbalances that affect brain function. I checked her sodium level, and it was 133, which is technically low. I proposed switching her from atenolol and HCTZ to Losartan 100 milligrams daily. She was hesitant because she'd been on her current medications for so long and they were working for her blood pressure, but I explained the potential cognitive benefits. We made the switch, and I saw her back 6 weeks later. Her blood pressure was still well controlled, her sodium level had normalized to 138, and she reported that she felt mentally sharper. We repeated her cognitive testing 3 months later, and her scores had improved significantly. She told me it felt like someone had turned the lights back on in her brain. This is not an isolated case. I've had dozens of similar experiences with patients who've benefited from switching to Losartan. Now, let me address when Losartan might not be the right choice. If you have a history of angioedema, which is severe swelling of the face, lips, or throat from ACE inhibitors or ARBs, you should not take Losartan. If you're pregnant or planning to become pregnant, ARBs are contraindicated because they can cause serious harm to a developing fetus. If you have severe kidney disease with very low kidney function, your doctor needs to carefully weigh the risks and benefits, as Losartan can sometimes worsen kidney function in people with advanced kidney disease, though it usually protects kidneys when started earlier in the disease process. If you have very low blood pressure to begin with, adding Losartan might make you feel dizzy and weak. These are situations where alternative blood pressure medications would be more appropriate. I also want to talk about the cost issue because I know medication cost is a concern for many people over 65, especially those on fixed incomes. The good news is that Losartan is available as a generic medication, and it's quite affordable. At most pharmacies, a 30-day supply of generic Losartan 100 milligrams costs between $10 and $25 without insurance, and even less with Medicare Part D or other insurance coverage. Compare that to some of the newer blood pressure medications that can cost hundreds of dollars per month, and you can see that Losartan provides excellent value. You're getting a medication with proven brain protective effects, kidney protective effects, and cardiovascular benefits at a price that's accessible to most people. This is one of the reasons why Losartan and other ARBs have become so widely prescribed. They offer premium benefits at generic prices. Let me give you some actionable steps if you're currently on a different blood pressure medication and you're interested in switching to Losartan. First, schedule an appointment with your doctor specifically to discuss your blood pressure medications. Don't just bring it up at the end of an appointment about something else. Make this the focus of the visit. Bring a list of all the medications you're currently taking, including over-the-counter supplements. Tell your doctor that you've learned about the brain protective effects of ARBs and you'd like to know if Losartan would be appropriate for you. Show them information about the studies I've mentioned if they're not familiar with this research, though most cardiologists and internists are well aware of it. Second, if your doctor agrees to switch you to Losartan, make sure you understand the monitoring plan. You should have blood work done to check your potassium and kidney function before starting, and again 2 to 4 weeks after starting. Third, monitor your blood pressure at home. Check it at the same time each day, write down the numbers, and bring that log to your follow-up appointments. Fourth, give the medication time to work. Don't expect immediate results. It can take several weeks to see the full blood pressure lowering effect, and even longer to notice improvements in how you feel. I want to emphasize something important about blood pressure treatment in general. The goal is not just to lower the numbers on the blood pressure cuff. The goal is to reduce your risk of heart attack, stroke, kidney failure, and dementia while maintaining your quality of life. This means choosing medications that control your blood pressure without causing side effects that make you feel terrible or interfere with your daily functioning. Losartan excels at this. It's effective at lowering blood pressure. It provides additional protective benefits for your brain, heart, and kidneys. And for most people, it causes minimal side effects. Compare that to feeling mentally foggy on a beta blocker or feeling dizzy and weak from excessive diuretic use, and you can see why more and more doctors are choosing ARBs like Losartan as first-line therapy for hypertension in people over 65. Let me also mention that Losartan works well in combination with other medications when blood pressure can't be controlled with one drug alone. It's commonly combined with a low dose of a diuretic like hydrochlorothiazide, and there are even combination pills that include both medications in one tablet for convenience. It can also be combined with calcium channel blockers like amlodipine if needed. The key is that Losartan should be the foundation of your blood pressure regimen if you're over 65, and other medications can be added as needed to reach your target blood pressure. Here's the bottom line. If you're over 65 and you're taking blood pressure medication, you deserve to be on a regimen that not only controls your blood pressure, but also protects your most vital organs, particularly your brain. Losartan and other ARBs have been proven in multiple large-scale studies to reduce dementia risk, prevent strokes, protect kidney function, and provide cardiovascular benefits beyond simple blood pressure reduction. The medication is well tolerated by most people, it's affordable as a generic, and it can be safely combined with other medications when needed. If you're currently on older medications like beta blockers or high doses of diuretics and you're experiencing side effects like fatigue, mental fog, or dizziness, or if you're simply concerned about protecting your cognitive function as you age, talk to your doctor about whether Losartan might be right for you. You don't have to accept side effects or settle for medications that were developed decades ago when we didn't understand the unique needs of aging brains and bodies. Modern medicine has given us better tools, and Losartan is one of the best. I hope this information empowers you to have an informed conversation with your physician about optimizing your blood pressure treatment. Your blood pressure is important, your heart health is important, and your brain health is important. With Losartan, you can address all three. Thanks for watching, and in my next video, I'll talk about the lifestyle changes that work synergistically with medications like Losartan to give you the best possible cardiovascular and cognitive outcomes. Take care of your health, and remember that being informed is the first step to being in control of your medical care.